How do I, as your fertility acupuncturist, assess whether or not you have adequate blood flow going to your uterus and your ovaries? Hello, my name is Cheryl Kujawinski. I am a fertility acupuncturist in the state of Colorado, and I want to let you know that blood flow, lack of quality blood flow, is one of the three main components I see with any of my fertility acupuncture patients. In Chinese medicine, we call it blood stasis. Blood is not moving very well, or you have low oxygenation of different organ systems in your body. Just like you were to see like spider veins on your legs due to poor oxygenation and blood stasis, the same thing can happen to some of those small arterioles in your organ systems. Okay, so how do we as Chinese medicine practitioners know that you have blood stasis? First, we look at your tongue. Yeah, your tongue. Your tongue is the only muscle in the body that we can see. So what we look for is actually red dots all over your tongue. If you have a lot of red dots all over your tongue, that tells me that there's blood stasis. Secondly, underneath your tongue, there's something called your sublingual veins. If they're very, very distended and purple, there's a good chance that you do not have good blood flow going to your core. Specifically, if you have distended sublingual veins at the root of your tongue, that's a big indicator that there's blood stasis down lower in your core. Second thing, sharp fixed pain. If you get sharp fixed pain during your PMS symptoms, when you're bleeding, that is a big indicator that we don't have good blood flow movement. And that can work with anywhere in your body, but specific to PMS and cramping, fixed sharp pain indicates blood stasis. Third, when you have your periods and they are very purple, very dark purple blood, clots even, that is another big indication that we don't have good oxygenation in the lower parts of our body. Finally, history of cysts, polyps, fibroids. Obviously, that's something that I as an acupuncturist cannot diagnose, but that's when we work with your OBGYN to determine that you have them in the first place. That to me is a huge sign that you don't have good blood flow going through your uterus or ovaries. Finally, how do we treat it? Acupuncture's primary function is to help move oxygenated blood flow around the body. We can target specific areas so the treatments can start shunting more oxygen to the parts that need it. And second is herbal therapy. There are tons of herbal formulas out there that help to move the blood to anywhere in the body, but specifically ovaries and your uterus to help you get pregnant. Let me know if you have any questions.